Hello, and thank you for the opportunity to present today. So I'm going to be discussing the burden of alcohol-related liver disease admissions over 6 years in Ireland. So my name is Clare Foley, I'm a gastroenterology SPR, and I'm the first Irish Liver Foundation Research Fellow. The Irish Liver Foundation is a registered charity that was recently established in order to provide information and support not only to patients with chronic liver disease, but also to their families and their healthcare providers. So the aim of my 2-year research project is to shed some light on the burden of not only alcohol, but also non-alcohol related liver disease in Ireland. And the following results will highlight the burden and the depth of the burden of alcohol-related liver disease admissions over a 6-year period in Ireland. So as you may be aware, mortality from liver disease has increased 400% over 40 years. Up to now, however, limited data exists on the contribution of alcohol-related liver disease in Ireland. This study evaluated inpatient hospital admission data from hypencoding information from 26 Model 3 and Model 4 hospitals in Ireland between 2017 and 2023. The following results highlight the depth of the burden of alcohol-related liver disease, especially in relation to inpatient hospital admissions, critical care stays, and mortality. So as you can see, over the 6-year period, there were 19,298 inpatient hospital admissions for liver disease. Although the split between alcohol and non-alcohol is relatively even, alcohol-related liver disease had more total bed days and more than double the total critical care bed days of non-alcohol related liver disease. And this comes with its own cost implication to acute hospitals. When looking at the alcohol-related liver disease patient cohort, 67% were male, the median age group was 54 years, and the alcohol-related liver disease admissions had an average length of stay of 13 days. When compared to non-alcohol-related liver disease admissions, alcohol-related liver disease admissions the patients were significantly younger and they stayed significantly longer than non-alcohol-related liver disease admissions. This graph evaluates total admissions for both alcohol and non-alcohol related liver disease over the 6-year period between 2017 and 2023. We can see here that in 2020 and 2021, we're seeing a spike in alcohol-related liver disease admissions. And it is felt this is likely related to alterations in drinking practices and increased home alcohol consumption during the first and second waves of the COVID-19 pandemic. However, this requires further evaluation. Notably, however, there's no significant change in non-alcohol related liver disease admissions during this 6-year period. I suppose most strikingly from our results was our results on mortality. Over the 6 years, there were 1,089 alcohol-related inpatient deaths. So this doesn't include mortality data from patients who died at home or died in hospice. These were just inpatient deaths. And the national inpatient death rate for alcohol-related liver disease was just over 10% and significantly higher than that of non-alcohol-related liver disease. And we can see from the graph here that over the 6-year period, the alcohol-related liver disease inpatient death rate is consistently higher than that of non-alcohol-related liver disease. And we do see a corresponding spike in inpatient death rates compared when we look back at our admissions data as well. This is a crude assessment of inpatient death rates for common reasons for presentation to acute hospital. We can see here that liver disease, both in relation to alcohol and non-alcohol related, so we have alcohol here in the orange, non-alcohol in blue, COPD and bronchiectasis in green, acute myocardial infarction in the red, and acute stroke in the dark blue. Liver disease, regardless of its etiology, has a higher inpatient death rate than both COPD and acute myocardial infarction, whilst alcohol-related liver disease demonstrated inpatient death rates similar to that of acute stroke. But what we see interestingly is that there is a reduction in the trend of inpatient death rates for acute stroke that's not evident in the alcohol-related liver disease deaths. And this likely represents the increase in acute stroke services and the extensive work that's been put in place by the National Acute Stroke Strategy. And in my opinion, further highlights the need for increased alcohol services and hepatology services nationally in order to battle the inpatient death rate for alcohol-related liver disease. I suppose this work highlights the huge depth of the burden of liver disease on acute hospitals. When comparing alcohol-related liver disease patients with non-alcohol-related liver disease, these patients are younger, they're more likely to be male, they have longer lengths of stay, especially in critical care. But I suppose most notably, they have an unacceptable inpatient mortality rate. But unfortunately, however, this is only the tip of the iceberg of alcohol-related liver disease, as this data only addresses inpatient acute hospital admissions. We have no data on outpatient attendances or attendances with the GP. The hidden aspect of alcohol-related liver disease is extensive and multifaceted and requires further review. Aspects for review could be the potential economic burden of alcohol-related liver disease, if you were to look at years of working life lost and the impact on the social welfare system as a result of same, or the social impact of alcohol-related liver disease in relation to years of life lost, carer burden, carer burnout, the psychological impact of growing up in a home with excess alcohol consumption, all require further evaluation. I suppose ultimately as a group, we have much more work still to do. And I would like to thank Professor John Ryan, Professor Stephen Stewart, Dr. Jennifer Russell and Mr. Declan McKeown for helping us get access to the hyperclinical data. Thank you very much.